Imagine this scenario. It is day 4 of the worst storm to hit your region in 30 years. The grid is down across 3 states. You walk into a pharmacy because there is one thing you forgot, and the place is chaos. The bandage aisle is stripped. The pain relievers are gone. Hand sanitizer, gone. Bottled water, gone. Anything with a recognizable name has been swept off the racks by panic shoppers in the first 24 hours. But here is the strange part. Just one aisle over, there are still products sitting on the shelves, untouched, quiet items, products the crowd walked right past on their way to fight over the obvious stuff. And if you knew what those products actually do, you would handle wound care, water purification, fire starting, dental emergencies, food poisoning, and dehydration for the next 2 weeks for under $50 total. Here's the thing, the panic missed those items because the labels do not say survival. The labels say baby care, allergy relief, dental health, athlete's foot. And the functions that keep you alive in a crisis are almost never the functions printed on the box. That gap between label and function is the entire reason these shelves still have product on them on day 4 when nothing else does. The crowd does not see what it does not recognize. I'm going to show you 9 of these items, all under 10, all sitting on pharmacy shelves in your town right now. Before we walk through each one in detail, here is the full list so you know where we are going. Number 9, zinc oxide cream, which is wound prevention disguised as diaper rash cream. Number 8, generic diphenhydramine, which is 4 separate medications in a single tablet. Number 7, 91% isopropyl alcohol, which is both tool sterilization and a wet weather fire accelerant. Number 6, activated charcoal capsules, the same compound emergency rooms use for poisoning. Number 5, clove oil, the only emergency dental anesthetic you can buy without a prescription. Number 4, super glue, a field wound closure originally developed for combat medics. Number 3, oral rehydration salt packets, clinically equivalent to an IV bag for $1. Number 2, petroleum jelly, the most reliable improvised fire starter ever invented. And number 1, povidone iodine, a 4-brown bottle that purifies nearly 600 liters of drinking water. That is the list. Now let me walk you through each one because the function is the whole story and the function is the part nobody knows. Item number 9, zinc oxide cream. You know it as diaper rash cream. That is the label. That is not what it actually is. Zinc oxide is a physical barrier compound, an inert mineral that sits on the surface of the skin and blocks ultraviolet radiation, moisture, bacteria, and mechanical abrasion at the same time. It does not absorb into the body. It does not degrade in heat. It does not need refrigeration. Sealed in a tube, the shelf life is effectively indefinite. Here is where the function diverges from the label. On any superficial wound, abrasion, minor burn, or chapped skin, zinc oxide does 3 things at once. It blocks bacterial entry. It holds moisture in the wound bed, so the tissue does not dry out and crack. And it creates a flexible seal that keeps the wound from forming a hard scab that tears open every time you move. In a real crisis, you are moving every day. You are carrying weight. You are using your hands. Wounds that do not close cleanly become infections, and infections without antibiotics become serious inside 48 hours. Zinc oxide is not a treatment. It is prevention. In a world without easy access to antibiotics, prevention is the only strategy that actually works. $3. Diaper aisle or sunscreen section. Nobody is fighting over it because the label says baby care. The function is wound management. Skin barriers handle what happens on the outside. What about what happens inside? That brings us to item number 8. Item number 8, diphenhydramine. You know it by the brand name on the pink and white box. That is one of its functions. It has 4. Function 1 is the labeled function, antihistamine, which controls allergic reactions from food, plants, and insect stings. In a crisis where you might be eating unfamiliar food, sleeping in unfamiliar places, or moving through brush and pollen and dust you do not normally encounter, allergic reactions happen. This handles them. Function 2 is sedation. Diphenhydramine crosses the blood-brain barrier and produces drowsiness as a side effect at standard doses. It is the active ingredient in nearly every over-the-counter sleep aid sold in the country. Same compound, different box, 3 times the price. Buy the allergy version. Function 3 is antiemetic, meaning it controls nausea and vomiting. If you have eaten something questionable, if motion sickness is taking you down on rough roads, if anxiety has your stomach in knots, diphenhydramine manages it. Function 4 is cough suppression, not the primary mechanism, but well documented at standard doses. 1 compound, 4 functions, 4 for 100 tablets in the generic version. The name brand sells out in every health scare. The generic version sitting right next to it, same molecule, almost never does. People buy names. You buy compounds. A note on this one. Diphenhydramine can cause confusion and falls in older adults, so the elderly should be cautious with dosage. Anyone with prostate issues, glaucoma, or heart conditions should read the package warnings before regular use. We have covered prevention on the outside and reactions on the inside. Now we need clean tools and clean fire, both from the same bottle. Item number 7, isopropyl alcohol, 91%, not 70%. This distinction matters and almost nobody understands why. Isopropyl alcohol kills bacteria by destroying the protein structure of the microbial cell, and the effectiveness depends on concentration. At 70%, the water content slows evaporation and gives the alcohol more contact time on skin, which makes 70% better for disinfecting skin and wounds. At 91%, the alcohol evaporates faster, which makes it less ideal for skin, but significantly more effective for disinfecting hard surfaces, tools, and metal equipment, where contact time is not the limiting factor. In a real crisis, you need both applications: clean tools, clean wounds. And here's the trick. You can dilute 91% down to 70% with water in about 10 seconds. You cannot concentrate 70% back up. So you buy the 91 and dilute when you need to. 1 bottle, both jobs. Secondary function. 91% isopropyl alcohol is a fire accelerant. Applied to tinder in wet conditions where natural materials will not catch, a small amount ignites immediately and burns long enough to establish flame in materials that would not light otherwise. It is not your primary fire starter. It is a problem solver for the specific situation where everything is wet and nothing else is working. The 91 bottle is usually on the same shelf as the 70, and it costs roughly the same, about $3. Almost nobody specifically reaches for it. You do now. Item number 6, activated charcoal capsules. Small bottle, digestive health section, around 8. Activated charcoal is processed carbon with a microscopic surface area so vast that 1 teaspoon has roughly the surface area of a football field. That surface adsorbs toxins. Adsorbs with a D, not absorbs. The toxins stick to the surface of the carbon and are carried out of the body. Here is what it does that nothing else over the counter does. If somebody in your group has swallowed something they should not have, contaminated water, spoiled food, the wrong wild plant, certain medications in overdose, activated charcoal binds those toxins in the stomach and intestine before they reach the bloodstream. This is the same compound used in emergency rooms for many poisoning cases, and the standard medical protocol is 1 gram per kilogram of body weight mixed with water taken within an hour of ingestion. Secondary function. Activated charcoal also helps control severe diarrhea by binding the bacterial toxins responsible for the symptoms. In a crisis where contaminated water and questionable food are real possibilities, severe diarrhea is one of the fastest paths to dangerous dehydration, and charcoal helps stop the bleeding at the source. 8. Indefinite shelf life if kept dry. Nobody connects it to crisis preparation. You should. One critical warning, though: activated charcoal blocks the absorption of medications taken at the same time, so if you take prescription drugs, do not take charcoal within 2 hours of your dose. And it does not work on everything. Strong acids, strong bases, alcohol, and petroleum products are exceptions. For those, get to a hospital. Item number 5, clove oil. Small bottle in the natural remedies section or the dental aisle, roughly 7. The active compound in clove oil is eugenol, a naturally occurring phenol with documented local anesthetic properties. It has been used in dentistry for over 100 years and is still used in clinical settings today as the base compound in temporary dental fillings and as a topical anesthetic for oral procedures. Applied directly to a tooth, a cavity, or inflamed gum tissue, clove oil produces local numbing that lasts 20 to 30 minutes and can be reapplied. In a crisis without access to dental care, which is almost every crisis because dentists are not emergency responders, dental pain is one of the most incapacitating conditions a human being can experience. I am not talking about discomfort. I am talking about the kind of tooth pain that makes it impossible to think, sleep, eat, or make decisions clearly. The kind that does not care that you have other problems. Untreated dental infections become systemic infections. They spread to the jaw, the neck, and in serious cases, the bloodstream. People die from untreated dental abscesses, and it happens in parts of the world without dental access on a regular basis. Clove oil does not treat the underlying infection. It manages the pain and buys you time. It keeps you functional while you figure out what to do next. No other over-the-counter product does this for a tooth. There is no substitute. You cannot improvise a dental anesthetic from anything else in a pharmacy. Pro tip: a whole clove from your spice rack, pressed gently against the painful tooth, will release enough eugenol to take the edge off if you do not have the oil. Not as strong, not as fast, but it works. 7. Natural remedies section. Almost nobody is stockpiling clove oil. You can. Item number 4, cyanoacrylate, which you know as superglue. That is the hardware store name. The compound was first synthesized by an American chemist at a major film company in 1942 and was widely used by combat medics during the Vietnam War as a field expedient wound closure for soldiers who could not be evacuated to surgical care fast enough to be stitched. Medical grade versions still exist today, and surgeons still use them on certain wounds. The over-the-counter version is chemically nearly identical, with a few additives the pharmaceutical version omits. Applied to a clean, edge-to-edge laceration, super glue forms a flexible bond that holds the wound closed while it heals. It prevents bacterial entry, it keeps the wound margins aligned so the scar is minimal, and it eliminates the need for stitches in any cut that does not go through deeper tissue. In a crisis where stitching is not an option for most people, this is the difference between a cut that closes in 5 days and a wound that stays open for weeks and gets infected. The rules are simple. Clean the wound first, stop the bleeding completely, pinch the edges together, apply a thin line of glue across the top of the closure, not inside the wound. Hold for 30 seconds. What it is not for: deep wounds, wounds with debris inside them, wounds on the face, wounds that keep bleeding under pressure. Any of those need professional care if it is available, and you should get to it. 2. At any pharmacy, office supply aisle or first aid section. A small tube weighs less than a single bandage and closes 10 times as many wounds. We have covered closing wounds. Now we have to talk about what happens when fluid is leaving your body faster than you can replace it. Item number 3, oral rehydration salts, ORS packets. Travel health or pediatric section, about 1 each. The oral rehydration formula was developed in the 1960s for cholera treatment in field hospitals where IV access was limited and patients were dying from dehydration faster than doctors could keep up. The formula is precise. Glucose, sodium chloride, potassium chloride, and trisodium citrate in exact ratios calibrated to maximize fluid absorption in the small intestine. The glucose is not for calories. It is the transport mechanism that pulls sodium and water across the intestinal wall. Without the glucose, the absorption rate drops. Without the correct sodium ratio, the osmotic gradient fails. The World Health Organization considers the ORS formula, when properly prepared, clinically equivalent to IV fluid replacement for all but the most severe dehydration cases. 1 per packet. A commercial IV fluid bag in a hospital setting costs $300 to $500 in the American healthcare system. The clinical outcome in early to moderate dehydration is comparable. In a summer crisis where heat, exertion, vomiting, or diarrhea are pulling fluid out of you faster than plain water can replace it, ORS is the intervention that works. Plain water does not replace electrolytes. Sports drinks do not have the right ratios. Pediatric electrolyte solutions are close, but are heavier, bulkier, and more expensive per dose. ORS packets weigh almost nothing. Shelf life is 2 to 3 years sealed, and a dozen of them fit in a coat pocket. Pro tip: if you cannot find ORS packets, you can make a reasonable home substitute with 6 level teaspoons of sugar and 1/2 teaspoon of salt in 1 liter of clean water. The ratios are not perfect, but they will save a life in a pinch. Item number 2, petroleum jelly. You know it as the white stuff in the small glass jar. Almost every American household has one somewhere, and almost nobody stockpiles it on purpose. Here is the function that changes how you see every jar of petroleum jelly you have ever walked past. A cotton ball saturated with petroleum jelly is the most reliable improvised fire starter that exists at any price point. The jelly soaks into the cotton fibers, which then act as a wick, and the cotton burns slowly at low temperature for 2 to 3 minutes per ball, regardless of wind or moisture conditions. 2 to 3 minutes of sustained flame from a single cotton ball, which is enough to ignite wet wood, green wood, or any material that requires extended flame contact to catch. Commercial fire starters cost $8 to $15 for a small pack. A jar of petroleum jelly and a bag of cotton balls costs about 4 combined and produces more fire starters than you will use in a month. Pro tip: the cotton balls stuffed in the tops of vitamin and supplement bottles are perfect for this. Free fuel. Do not throw them away. The labeled function, wound protection, is equally important. Applied to a clean, closed wound, petroleum jelly creates an airtight barrier that prevents air and bacteria from reaching the tissue. This is the same mechanism used by medical-grade wound dressings that cost 10 times as much. Important note: apply petroleum jelly only to clean, closed wounds. On open or contaminated wounds, the seal can trap bacteria and accelerate infection instead of preventing it. Clean first, close the wound, then seal. Additional functions: lubrication for any metal-on-metal contact, moisture barrier for skin in cold or wet exposure, especially on the face, ears, and hands, leather and fabric water repellent, rust prevention on tools and metal surfaces. Shelf life is indefinite. Petroleum jelly does not degrade, does not dry out, does not expire. 4 a jar on the shelf in every pharmacy in the country. Item number 1, povidone iodine, the brown bottle. You have seen it your entire life. It has been in every American pharmacy and first aid kit for decades. Most people know it as a wound disinfectant, and that is the first function. Now, let me tell you about the second function, the one almost nobody knows. Povidone iodine purifies drinking water. You heard that right. The iodine content in a standard 10% povidone iodine solution, which is the concentration of the bottle you can buy at any pharmacy, is sufficient to kill biological contaminants in water when used correctly. The protocol is straightforward. Protocol: 8 drops of 10% povidone iodine per 1 liter of clear water. Wait 30 minutes. The water is safe to drink. For cloudy or turbid water, double the dose and double the wait time. Here's the math. A standard 8-ounce bottle of povidone iodine contains approximately 4,700 drops. At 8 drops per liter, that is approximately 587 liters of safe drinking water from 1 4 bottle. 587 liters. 4. The same bottle that disinfects wounds and cleans contaminated surfaces also purifies nearly 600 liters of drinking water, and almost nobody connects the two functions. The wound care bottle and the water purification tool are the same object in the same brown bottle on the same shelf in every pharmacy in the country. A personal note on this one. A few winters ago, an ice storm took the power out across my region for 9 days. On day 3, the pipes in the house froze and ruptured, and the city water went out across the neighborhood within hours of that. I had a bottle of povidone iodine in the medicine cabinet because my grandmother always kept one, and I had picked up the habit. That bottle gave me clean drinking water for 2 adults and a dog through the rest of the week. The ceramic filter I owned never came out of the box because I had loaned it to a friend the previous fall and never picked it back up. The brown bottle was already in the house. That is the entire point of this video. The right tool is the one that is actually with you. One important warning. If you have a known iodine allergy, a thyroid condition, or you are pregnant, do not use povidone iodine for water purification on a regular basis. You will need a different method. Boiling, mechanical filtering, or chlorine drops are all options. 4. First aid section. Before we close, a quick safety block on the whole list, because some of these items can hurt you if you use them the wrong way. If something burns fuel, ferments, evaporates, or comes in a bottle with warnings on the label, read those warnings. None of these items replaces a doctor. They replace nothing in an environment where a doctor is available, and they replace nothing for serious bleeding, broken bones, severe burns, or any wound that exposes deep tissue. They are gap fillers for the situation where professional care is unreachable or temporarily unavailable. Doses on the bottle are not suggestions, they are limits. Read them. Especially with diphenhydramine, especially with activated charcoal, especially for children, the elderly, and anyone with chronic conditions. Knowledge is the cheapest tool you own. Use it. You walked into this video thinking 9 items, 9 answers. Now you know it is 9 items, more than 30 functions, and a brown bottle that purifies almost 600 liters of water for 4. The labels describe 1 job. The products perform 5. The gap between those 2 facts is where preparation lives. Thanks for watching. If this changed how you see a pharmacy aisle, hit subscribe. There is more where this came from. Stay sharp. Stay prepared.